speak briefly on transmission. It's transmitted by person-to-person contact. That involves direct contact with broken or mucous membranes. Mucous membranes are your mouth, your eyes, which need to be protected, and it can be transmitted by any bodily fluid, from blood to vomit to urine to stool to breast milk, and so any bodily fluid that comes in direct contact with an open wound, an open sore, or unprotected mucous membranes. It cannot be, or this strain is not transmitted through the respiratory means. So it's this strain of Ebola is not transmitted through respiration. Other ways people can get this is in that country is eating contaminated meat or ingesting it, or contact directly with animals. The natural reservoir of this disease has not been identified, but it's suspected to be an animal such as the fruit bat, as well as other primates such as apes and monkeys and things like that. Ebola is inactivated, importantly, after cooking and heat. So anything that's incinerated or heat kills the virus. And there's no evidence that it's transmitted by mosquitoes or other vectors, other insects. Like yellow fever, for instance, is transmitted by a vector, an insect. Ebola, there's not been a case that's been transmitted through insects.
We stay in a continuous state of readiness by continuously training our staff, staying up to date with the CDC guidelines that are changing on a seemingly regular basis. They came out with some new guidelines yesterday, so we are training our staff up to those guidelines. Primarily, what we are teaching people, not only our acute care facility, meaning the hospital, our outpatient facilities, and doctor's offices. We work with emergency management here, first responders, is the fact that the first thing that we're going to do is screen patients. And that can rule out a lot of patients. The first question you're going to ask them is, have you traveled to West Africa, the 3 countries that Dr. Pino spoke about, within the last 21 days? If they have not traveled to either Sierra Leone, Liberia, or Guinea within the last 21 days, they are automatically ruled out as a suspicious patient. If they say yes, they have, then the next question that we're going to screen them with is, do you have a fever? If they say yes to that, and they say yes and yes, then they're considered a potential patient. So then we teach our staff to isolate the patient. Give them a mask and isolate them in a private room, close the door, and then they will call one of our infectious disease doctors and myself, and then we will respond to further screening of these patients. If that patient passes the further screening, then we will bring them to the hospital and treat them as what we call a PUI, patient under investigation. So then they would come to the hospital, they would be isolated at the hospital. Our staff have been trained how to care for these particular patients. Bulk of our training for our staff members has been in what we call PPEs, personal protective equipment. And you may see that on TV with the big hoods and the white suits and the boots and all those things. It's very important that you know what type of PPEs to wear and how to put them, what's called donning and doffing. Putting these on in the correct order, and very important that you take them off in the correct order. Because if you have a contaminated piece of equipment and you take it off incorrectly, you can then contaminate yourself. So we spend a lot of time, hours and hours and hours, of training with our staff members, from physicians to nurses, to our care techs, to our radiology techs, to our housekeepers. Anybody who may have to come in contact with that patient needs to know how to don and doff PPEs correctly. So we're stressing the safety of our staff members for sure when taking care of these patients. So